So earlier on this channel, we actually spoke about a split brain syndrome. And we said that one of the disadvantages of a split brain syndrome is if you place something in the right visual field of the patient will be able to identify it. But if you place this thing in the left visual field of the patient, they will not be able to identify it. Okay? So that why is it that what a patient who have their corpus callosum section. Corpus callosum is the nerve fiber bundle of nerves that connect the left hemisphere and the right hemisphere of the brain. So if you cut it, that means what? The right side of the brain will start behaving independently of the left. Alright? So we are saying that what? Why is it that a patient who have corpus callosum sectioned to relieve symptoms of epilepsy can see and read things, okay, or words presented on their right visual fields, but cannot be able to read words presented on their left visual fields? You have to answer this, give reasons why. So going briefly to it, so that when the corpus callosum is sectioned, the two hemispheres of the brain are no longer connected. Because the corpus callosum, this corpus callosum here, is basically what is linking the right side of the brain to the left side of the brain. Okay. So this can lead to what? An interesting phenomenon, especially in terms of visual processing. Okay. So for visual processing, the right visual field, information from the right visual field is processed by the left hemisphere of the brain, which is typically responsible for language and speech in most people. We're trying to lead to something, right? The left visual fields, information from the left visual fields was processed by the right hemisphere, which is not typically dominant for language and speech. I guessing something. So let's move now. So why the difference? For language process, so when words are presented to the right visual fields, the left hemisphere can still process and understand them, allowing the patient to see and read the words. Okay? The lack of communication. When words are presented to the left visual fields, the right hemisphere will process the information, but it is not dominant in language and speech. You get? But it cannot easily transfer this information to the language dominant left hemisphere. This is due to what? The severed corpus callosum. Right? So this phenomenon is often studied in split brain patients or split brain syndrome or callosal disconnect syndrome. Okay? And this is basically people who have undergone a surgical procedure to sever the corpus callosum, which is usually used to treat what? Epilepsy, right? So they treat epilepsy, but this is like the side effect, okay? So that's the why patients with sectioned corpus callosum um, will see and read words presented on the right visual fields, but not on the left visual fields.